So to get the presentation started for today, an overview of some of the things that we're going to be looking at. Sorry about the picture there. So the presentation will include various community resources in the St. John's area, as that's the area that we are residing in, so that's what we've chosen to talk about today. And these are going to be relevant to individuals with Alzheimer's disease or related dementia, and these will also be great suggestions for our PCA students as well. So resources. When we look at our resources, accessing healthcare can of course be challenging for everyone, even just determining the right phone number to call. But let's take a look at our healthcare system, and hopefully we'll be able to have a better grasp on it and understand some better places to turn at appropriate times. So first off, I'll talk a little bit about hospitals. Acute care is available to entitled residents of Newfoundland and Labrador through either our inpatient or outpatient services at hospital facilities or through at-home services. A variety of services are offered to seniors by health professionals in our hospital facilities, and some examples include our medical, nursing, and all diagnostic and therapeutic services, so our respiratory therapy, physiotherapy, and all of these other things. The admission and care provided to patients in a hospital facility is the responsibility of an authorized physician. And I'm not sure if Shirley had anything too that she wanted to add on the acute care as well in relation to our Alzheimer's or dementia.
Well, acute care is, I guess, one of the needs that sometimes people with Alzheimer's disease enter the healthcare system. They end up in emergency rooms or are brought in to the Waterford Assessment Unit. Ideally, in terms of the, the care for someone with Alzheimer's disease, the smoothest transition would be pre-planning for the future and looking at placement options at least 3 months prior to being ready for that, because otherwise the person does end up in acute care on a temporary basis, and most times acute care is not necessarily the most appropriate place for a person with Alzheimer's disease because they don't have the staff requirements to be able to respond to the individual's needs if a person was a wanderer or something of that nature. And obviously we want them in the most accommodating environment for the person with the disease. So ideally, as I said, 3 months out in pre-planning would be the perfect solution to being able to do that. But it is one way that people with Alzheimer's disease do enter the healthcare system.
Perfect, thank you. And for those who just came in, there's a few extra chairs there if you wanted to pull one over. So to speak a bit more about our community health centers. So our community health centers here that I have listed would be general numbers that you can call to inquire about setting up one of these type of appointments or seeing if this is the best option for the type of care that you're looking for. So the home and community care clinics are actually nurse-led clinics that provide clients with various services that include wound care, medication injection, IV therapy, and post-surgery care, and many other things like this. So these clinics are located throughout Eastern Health region, and they can be contacted by one of the numbers that I have listed here. So for our mental health emergency services and things like that, we also have after-hours health centers, the psychiatric assessment unit, which Shirley did mention, and this is at the Waterford Hospital. These emergency services include a number of medical and mental health professionals, and they're trained to assist you through crisis. Oftentimes, the emergency intake at the Waterford Psychiatric Assessment Unit is once a crisis situation has occurred, and that's when we usually see individuals going to these type of units. It is usually ideal, and the reason we have put in place this First Link program is to help our caregivers better understand the disease and, like Shirley was saying, be able to plan for the future and already be prepared to be able and avoid these crisis situations. The more planning and knowledge that people have beforehand, then hopefully the better we'll be able to reduce the amount of incidents that they have and the intensity of those incidents as well.
And just but as part of that as well, ideally, people who are enrolled on the First Link program will be followed through the journey of the disease by Megan, and in that process, she will identify certain points that you need to consider alternative options of care. She would say, well, maybe you need to consider this service and things like that. So it also helps families with pre-planning.
Definitely. And I want to mention too that the mental health crisis line, which is listed here, is actually a free confidential service. So they're able to assist you province-wide 24 hours a day. And it's for individuals who feel that they are unable to cope or unsure where to turn for help. So that is not only for our caregivers of Alzheimer's and dementia patients, but that's also just a great resource to have knowledge about. So on our resources, where do we start? Community resources are people or programs that can help you while you're at home. So what's out there? Because there's always so much talk around, oh, there's so many great community programs, just go on out there and they'll be right there to help you. But who are they and how do we get a hold of them? So our available services, I'll go into more detail on each of them now, but our home support services, our respite services, our Seniors Resource Center, Victorian Order of Nurses, St. Luke's, and Red Cross. These are all really great community resources here. So to talk a bit about home support services are in place to provide support in the community and prevent admission to hospital or long-term care. So we talk a lot about remaining at home for as long as possible, and we are using the First Link program to educate people on how to maintain that quality of life at home. So to access these services, an individual must be giving a referral from their family doctor or physician of that sort, or a community health nurse. And then from the discharge planner, when you leave the hospital, that's another avenue where you can grab it. And anyone can also request an assessment for referral for home support services. And the intake coordinator number is listed here on your presentation. And for the new people who stepped in, the presentations are provided over there for takeaway. So the services of the home support are in place to, of course, provide support in the community and prevent that admission to our long-term care. And then to move on to respite services, these services are refer to different services that may be available to caregivers so they can take a break from their caregiving responsibilities. And this is really great to avoid our caregiver burnout and crisis situations that we were talking about earlier. By having access to these respite services, they're able to either informally, through in-home respite of family support and relief, volunteer through one of the programs I mentioned earlier, like Victorian Order of Nurses, or by paid companionship and different health assistance and things like that. Or you may be able to avail of respite through out-of-home respite, so St. Luke's as 10-a-day program there or something like that would also be a good relief for the caregiver. The Seniors Resource Center is one of the available community services which was listed earlier, and they are an amazing resource for not only seniors but for our Alzheimer and dementia caregivers as well, because they are very caregiver oriented there at their organization. They're dedicated to promoting the independence and well-being of seniors as well and our older adults in Newfoundland and Labrador. And their programs and services are quite lengthy. They do have a toll-free information and referral line, And oftentimes, if you call their toll-free and information referral line and speak about Alzheimer's or dementia, they're going to pass you on to us. So be prepared for that. They'll get you our toll-free number then. Our provincial community peer support program. They have seniors bridging programs. The Mall Walkers Club. These are all very popular programs, which we have brochures on out here if you would like more information on them. But the ones like the Mall Walkers Club and all of these different programs are great ideas for social interaction for individuals who have been diagnosed with the disease, and also for that bit of respite for the caregivers as well. So there are a lot of advantages to availing of the programs and services of different community groups.
It also acts as a form of stress relief for the caregiver when they are faced with the caregiving role. As the Alzheimer Society, we always encourage them to take breaks, and the Senior Resource Center is a really good way to channel that so that they get community networks of people, because they'll say, oh, fine, I need to take a break, but what do I do? So we always refer them to the programs that they have to offer so that they can start getting new networks of friends to be able to participate and help them reduce stress.
Definitely, and they're really large. They actually do a day away event through one of their other organizations as well. So they have a whole day of events planned for caregivers so they can take the day away from caregiving and have that day of rest and relaxation to hopefully avoid burnout. To speak a little bit about the Victorian Order of Nurses, they also have several different community programs and things. Their SMART program is a gentle fitness program for community members 55 plus. This program has highly trained volunteers who come into the home and go through a series of different exercises with an individual who wishes to avail of this. And these exercises are based on their mobility needs as well. So if this senior has maybe a hip issue, they will work around that to either avoid irritating it or to do exercises to strengthen and build back that hip mobility. So this is a really great program for the individuals who we service here, because oftentimes fitness leads to better health, and we really promote healthy living here, as well as the stimulation of fitness helps with day-to-day life. The nursing programs and services, foot care programs, and all of these different ones are really great. They also have a companionship program, as I mentioned in earlier slides. They have volunteers who would come into the home and sit and read or play a board game, card game, whatever it may be to pass the time with a senior. And whatever they enjoy, whether it just be sitting and watching TV together. Sometimes when seniors are living alone at home, this would be a really ideal program for them, especially if they have mobility issues. So getting out into the community to day programs and things may be an issue. So having a volunteer from VON come in and sit with them and read with them and things like that may be more ideal for their situation. So St. Luke's Homes is a really great resource as well, and I'm sure that some of you may even end up down there on your work terms for the PCA students that are here. The adult day program is both day programs are really great services which St. Luke's provides to individuals not only with dementia but without dementia as well. So the Adult Day program provides social and recreational programming for seniors living in the community who have limited access to resources such as due to physical, cognitive, or social barriers. So these individuals may be in the beginning stages of memory loss. For us, are individuals who have been newly diagnosed and are still able to function quite well in their day-to-day life, would be participants of our Adult Day program. And then the Respite Day program provides participants who have mild to moderate dementia or impaired social functioning with the social and recreational programming. So these offer a lot of different activities. They do tea in the morning, lunch, they have arts and crafts and entertainment and a beautiful patio and garden and things like that for the summer as well. So they do have a really great facility there. It's a really welcoming community of staff and residents and participants of these programs as well. So we highly recommend these programs, and the social worker and nurse who are employees over there that coordinate these programs are really trained professionals, and they are great at what they do and really connect with these individuals. So this is always a great community resource to suggest to caregivers for a bit of respite relief.